Thank you. Thank you for this amazing opportunity to be talking here. And I'm quite recent in this program. I joined in November. Oh, thank you also for this amazing possibility to be part of this ambitious and amazing group of people. So we can probably all agree that health and healthcare is one of the most important things in designing the future sustainable society. We all want to live longer. We all want to live healthier. We all want to find cure for diseases and conditions that we don't know yet how to cure. So in the future, we want to see a better, functional, sustainable healthcare system. But at the same time, there are lots of sustainability-related challenges in making this happen. And I will start my talk with going through some of them. So first of all, when we talk about sustainability, healthcare system is also one of the sectors that has sustainability environmental impact. It's not horribly huge. You can see here that the emissions of healthcare system in Finland are 5% of the national footprint, whereas the GDP proportion is 9.5. So proportionally with GDP, healthcare is not like the worst producer of emissions. But of course, emissions is also one part of the environmental sustainability. Healthcare has a big impact also in other environmental factors, like, for example, the toxicity of our environment. The pharmaceutical industry, for example, has a big impact on toxicity levels of the environment. Also, a very big aspect in the future in regards environmental sustainability in health is that the global warming and other environmental changes will affect our health. So we will have more or different health conditions, health problems because of the warming of environment and changing of our environmental aspects like nature and biological things. The second sustainability related aspect is health inequalities. Even here in the Western countries, in Europe and Finland, we can see differences in how different population groups have access to healthcare and their health conditions. In this figure, you can see that the poorest population has almost 20% less a subjective evaluation of their health in regards of good health and 10% in bad or very bad health, which indicates that there is an accessibility and kind of matching a problem with our healthcare system in different groups of populations. This is, of course, even more dramatic if you look this globally. We here in Finland have much different healthcare access possibilities than people in many other parts of the world. And it might be easy to think that, well, it's their problem, we take care of our healthcare system and try to optimize that. But if you think of like the safety and the stability elements of global environments, that's not so. So we really need to be mindful here in the more developed countries, in Western countries, about the inequalities we create globally, because that might be a big source of instability in society. Then a third factor I wanted to raise here, because I was listening to news this morning and we have the elections coming, and this economical, fiscal sustainability of the healthcare system is of course something we hear every day. That how can we sustain the costs, the rising costs of healthcare in the future? It's really interesting to listen to the politicians who are in Finland we say in between the wood and the bark, when they try to say that, yes, we want to develop our healthcare system to be better, but no, we don't want to put more money on that, and how they are tackling this situation. So it's been quite long already that the kind of increase of healthcare cost has been more rapid than the increase of GDP. So the gap in between is increasing all the time. This is a pretty old prediction. I think it's like 5 years old, and it estimates that in 2030, the public healthcare expenditure would be 9.5, and I think we are there already. So 23, in Finland, we already have reached this 9.5. So this prediction already seems that it's too conservative, and we will be spending more in healthcare that we expected then. So these are some issues that make healthcare a very, very important topic to consider when we are creating a more sustainable future. And that's why, for example, in European Union, healthcare is one of the sectors that are very central in creating future visions and future policies. Like, for example, in the Digital Compass, we have healthcare-specific targets for Europe. For example, in access of electronic health records, it's specifically mentioned in the Digital Compass. And also the first sectoral data space, European data space, will be a health data space, kind of implementation of Data Act. It will be specifically in health. So politically, health is something that Europe and the national governments are paying lots of attention policy-wise. And one of the essential components that we see there in those policies and future visions is that digitalization would be one of those key elements, that how do we make healthcare system more sustainable. So in the rest of my talk, I was planning to go through 3 of my unit's research areas, where we try to explore or are exploring these digital elements that would make healthcare more sustainable. And I've grouped them here into digitalization of care pathways, which is kind of this citizen-centered healthcare part. And then that health data spaces, which is this data-driven part. And then last one, the capacity that makes all that happen would be digital capacities and skill building. So first, the digitalization of care pathways. That's something that's very, very much already happening in research and also in practice. For example, here in Oulu, Oulu University Hospital, or what is it called now? I don't know what hyvinvointialue is called in English. We have this new organizational structure for delivering healthcare here. They are very, very active in digitalization of care pathways. We already have thousands of patients who are offered a digital way to monitor and access the health a condition-specific care. Like, for example, if you go to an operation, the pre-operation, post-operation activities can be offered you online. So you can receive information on how to prepare before the operation, and then you get rehabilitation instructions or monitoring instructions afterwards. Or if you are ongoing a treatment that requires regular monitoring or regular monitoring data, you can also be offered an access to a digital care pathway. These are still relatively simple. There's not much AI or kind of smart functionality involved. So it's mostly like advanced website with information, images, videos, maybe a possibility to contact and chat with your healthcare provider, a healthcare professional, and a possibility to book appointments, like pretty standard, simple functionalities. But still, it can make a big difference in the most efficient use of healthcare system. There are expert opinions saying that 35 to 40% of the current touch points in healthcare system in Finland could be digitalized without sacrificing the quality of the healthcare delivery. And 35 to 40%, that really makes a difference in the resource-efficient use of healthcare. Of course, this 35 to 40% kind of refers to current way of delivering healthcare. There's of course huge amount of possibilities to provide care and to create new things in healthcare with digitalization, something that doesn't really exist yet. And there we have even more possibilities for digitalization to really change the way we deliver healthcare. What is pretty amazing in this process and in this way we digitalize care pathways here in Oulu, and I think also elsewhere in Finland, is that the digital care pathways are actually designed and implemented by the care professionals, by the clinicians. So there's no huge amount of coders or designers at the hospital who create those care pathways, but they are the clinicians who actually deliver the care. I'm a software professional by education, and I think it's pretty amazing how technology is already at the level that the end users are able to create digital tools that can be used by patients. And I think this is an area where we will see lots of developments and lots of things we can't really see yet in regards citizen-centered healthcare, because we will have more low-code, no-code environments where non-professionals can create digital solutions. We even might have, like, many of you have probably used ChatGPT to create something. So with this experience, it might not be that difficult to believe that in the future you could ask ChatGPT to create you a mobile app for diabetic patient. So there will be these generative tools that can help patients to create their own health applications. And I truly believe that this patient activism, where the patients will be able to create their own healthcare solutions, use them, because they are really the experts of what they need. That will be a big thing in the future. Oh, well, one of the examples of digitalization of care pathways, which me and my group are currently doing, is a tool where we are creating a mobile app-based digital health solution for MS patients. So it's called More Stamina, and it's targeted for MS patients and for fatigue management for MS patients. It's one of the symptoms that currently doesn't have an effective medical or treatment. So it's a symptom that is very difficult for MS patients. So we have created this solution that kind of translate activity monitoring, activity data into something that helps the users, helps the patients in managing their fatigue-related symptoms. Right now we are in a state where we are piloting this with the hospital, with the neurologists in hospital here in Oulu, and we are planning another trial with Trinity Trinity College Dublin. So we are in a stage where we see how the patients actually use it and what's the impact there. In this exercise, where we look at this specific tool, digital therapeutics tool in a specific digital care pathway, the biggest technical problem we have faced is the interfacing to external data sources. So we are this tool is to refine and use activity data like Fitbit data and that sort of the thing data into this fatigue management functionality. So we need to have lots of external interfaces for external data sources. And that has been the most problematic part in the pilot, because all those interfaces, they first of all change all the time. So even though it works at one point of time, there's no guarantee it works the next week. And it also has lots of technical parameters that has to be just right, that the syncing between the data sources works. So this problem of using all these different data sources provided by different data vendors and stored in different data storages, that kind of highlights a difficulty that we currently have in implementation of digital care solutions. And there is a solution or a proposed solution for that, which is the European Health Data Space, which is another area of research we are working on. So European Health Data Space is the sector-specific implementation of the new European Data Act, which aims at creating competitive environment in Europe to compete against the American and, on the other hand, the Asian way of using data access. So in Europe, we want to create like European value-based data sharing environment, which is democratic, transparent, and federated, and not like corporate-led like in the US, or like government-led like in some of our neighbors towards the east. So European Health Data Space is this attempt of Europe to create this single market in Europe that a digital health solution provider can access the data using the commonly agreed principles that are, of course, secure, privacy preserving, and value creating. So that's another area we do actively research on right now. Well, to make all this happen, to create these digital care pathways that will increasingly use more smart features like AI-enabled functionalities, we need also skilled and competent healthcare professionals. So we need to invest on first of all, creating future-proof curriculums, how we educate our healthcare professionals, not just GPs, but also nutritionists, physiotherapists, everyone who are in a loop of delivering healthcare. So our education system needs to be changed or developed further. And that is why I think it's amazing that we have this profiling project here at the University of Oulu, because that gives us a possibility to use this research-based competence in also impacting our education. But of course, it's not enough just to develop our curriculum, degree curriculums, but there's also a huge pressure in the existing workforce for upskilling and reskilling, so that the people who are already working are able to take part in the innovation process for digitalization and then optimally use the digital tools in their work. So as a university, in my opinion, we need to develop this upskilling, reskilling capacity, that how do we tap into the needs of the healthcare system and are capable of providing the educative elements that are needed. All this requires cross-disciplinary competence. So it needs to be delivered in a cross-disciplinary setting and not siloed in faculties, for example. And that's also something that where this specific program that I'm now so happy to join, it has lots of opportunities and possibilities. So in the end, I would just want to finalize with this slide kind of illustrating this perfect match of humans and technology in the loop to creating this more sustainable and brighter future for us in healthcare. Thank you.
Thank you, Minna, for your excellent and inspiring talk. And you also pointed out all those important aspects that we really have to take into account concerning education and so on, and also, as you mentioned, education of the currently working staff. So I think that, as you mentioned, so we really should focus and further clarify our plans concerning research also on that education field. And they should develop in parallel.
Absolutely, absolutely. You are completely right on that. And I'm happy to say that we have already started it. We have collaboration with Christina here and Simo there. So we are already working on that area.
Yes, and also concerning from funding abilities and funding resources, more funding should be focused on this area.
Absolutely, and there's luckily this Digital Europe program, brandly launched Digital Europe program, where there's lots of money available for developing education. So we need to be mindful about that.
Yes, and we are very grateful for that opportunity. And then there's one question in the event room. So how do you think software and networking researchers would better work together?
Software and networking researchers?
Yes.
Okay. Yes, I first of all, kind of to give me a bit of time to think, I must say that I really think that this cross-disciplinary work needs to be done. Software and network. Software network researchers are luckily, I think, in the same faculty. So we are in IT. So that also provides some framework for collaborative activity. But how to better facilitate this collaboration? Difficult question. Of course, network kind of enablers, functionalities are software-based. So there is kind of this software element in network research. So we probably have like areas that are already very much overlapping. So maybe the easiest way for facilitate collaboration would be to start from those parts that are already overlapping. And then when we get like better collaboration on those parts, then the expansion in the areas that might be kind of complementary but not that evident might emerge.
Yes, thank you very much.